All right, ready.
Hi, it's Dr. Lucero, your school superintendent. I hope you had a wonderful spring break and have gone back to school and transitioned back in well. We're so excited that you're joining us here tonight. This is such a great opportunity for the Stamford Public Schools, and I would be remiss if I didn't take a moment to thank Olympia Delafleur, our Associate Superintendent, who really has been the lead on this for our school district, and Laura Berwick, who always is willing and ready to help the Stamford Public Schools, who represents the city. So I just wanted to take a moment to thank both of them. And a person that I did not know her name 3 weeks ago, and I've heard her name more in 3 weeks than any other name, which is Amy Taylor from CHC, who has just done an amazing job really opening up the doors for our students. We talk about that often in Stamford Public Schools. We're trying ways to open up the doors. And one of the things that we're attempting to do next week is to return our high school students to school 5 days a week. And vaccination is now one of our next mitigating strategies that we will have in place for our students. We talk about the suite of strategies that we have to keep everyone safe: mask wearing, hand sanitizing, and now we will have our students vaccinated. So we are so excited that you are here to present to us tonight and help our families understand what process they need to go through. So I'll at this time turn it over to Olympia to get us started.
Dr. Lucero, and thanks for joining us to give our welcome tonight. So we are going to have a very informal conversation this afternoon, this evening, regarding the COVID-19 vaccine for our 16 and up. And so, just in my own experience, I just want to share, I was a little hesitant about getting the vaccine myself, and many of my friends and family were as well. And I think information is really important. And it's really important to have these conversations. And I just would like to say, if there are questions after the webinar, or you feel like you really want to talk something through with someone, if you would reach out to us, we would gladly help you get the information that you need to make an informed decision. I did decide to get vaccinated. I'm fully vaccinated now. And so I really just want to press upon everyone who's listening to this call that we know it is a personal decision, but it really is important for you to get the information that you need to make the best decision for you, for your child, and for your family. So we are joined tonight by Laura Berwick, who Dr. Lucero mentioned, and Laura is the head of all of our vaccine coordinations for the city of Stamford. So she works very closely with the school district, not only for students, but also with staff and in the city. So she's just going to be here helping us if there are questions in the chat tonight. We also have Mike Meyer. He's our Director of Office of Family and Community Engagement. He also helps families. So if you have those questions, you'll probably go through Mr. Meyer. And he's also been playing a very heavy role in making these happen. And last but not least, we have Amy Taylor, who's the VP of Community Health Center, Inc. And we're also joined by Dr. Dan Walensky from CHC, and he's our panelist doctor tonight. So Amy will be on to answer any questions about the vaccination clinic and to provide some information about what's happening this weekend. And then we have some questions already prepared that we've received for Dr. Walensky. So I actually, maybe Amy, if you want to go ahead and just start and just give some information about what's happening this weekend, any logistics, and then we'll get into our FAQ.
Thank you, Olympia. And first, I just want to thank the city of Stamford, both the school system, Mike's office, the mayor's office. As you know, CHC has been a part of the Stamford community for probably 12 years now, 12 to 13 years. And during this pandemic, we've been very fortunate to be able to participate closely and collaborate closely with the city to, one, provide a lot of testing services at the start of the pandemic, and now continue to provide those testing services. But even more importantly, I think, to provide really extensive vaccination services. And we couldn't do that without partnerships. And it's partnerships with the city, with the school district, with all of the wonderful social service agencies in the community that have really allowed us to bring vaccinations and bring testing not only to those who can easily access it, but also to those in very difficult to reach parts of the city. To date, we've done about 61,000 vaccines within the city. Many of those are in really hard to reach parts of the city. But we also, as many probably of you know, at the old Lord and Taylor have set up a mass vaccination clinic. And that's where we are really, really looking forward to welcoming our Stamford High School 16-plus-year-olds. So that's 16, 17, 18, and if there are any 19-year-olds out there, we're really looking forward to welcoming you this weekend. To date, we have on Saturday just over 400 people registered, and on Sunday we have just under 150 registered. And within the last week, we have brought in more vaccinators. And so we now have 30 vaccinators at the Lord and Taylor site every day, which has allowed us to increase the number of vaccines that we're doing to about 2,400 a day. So what does that mean? Why should you care about that? Because it means that we can vaccinate this Saturday and Sunday many, many more students. And we've also, in collaboration with the city and the school system, have decided that we will open up these reserve slots to the staff of the Stamford school system, but also to the families of the Stamford high schools. And so if you're participating, that means that not only if you're a 16, 17, or 18-year-old high school student, but your families can also register for being vaccinated on this Saturday and Sunday. You don't have to call the VAL line. You don't have to go on to VANS. You just simply click the registration link, put in your information, select the time you want to be vaccinated, and then come to Lord and Taylor at the time that you've selected, and we will very happily vaccinate you alongside of your child. And I know Olympia will be sending out a communication so that all of the families, whether or not you're participating in this webinar tonight, hear that information. And so we just encourage you to make a decision that's comfortable for you, comfortable for your family about the vaccine. Of course, we as a health center, we strongly encourage people to get the vaccine. We see the benefits of the vaccine in terms of reducing the risk of getting COVID-19 and getting very, very sick from COVID-19. And also we know that as soon as we reach almost mass vaccination across our communities, we will be in a much, much better place. And we also want the schools to be a place where not only are the teachers vaccinated and the staff at the schools, but also the students, so that they are much safer environments for students and teachers to go every day. The impetus of this clinic this weekend for the students was really the notion that we know that students have gone through a whole lot. Our students, whether they're in Stamford or any other community over the last 12 months, have had very different types of experience. And we know that students are resilient, and our students have done remarkably well over the last 12 months. But we also know that students like tradition, right? Students like to go to prom when it's that time of year. Students like to march for graduation. They like to participate in senior activities. And they like to do all those rites of passage with each other. So, you know, when we knew that the governor was going to lower the age restriction or age eligibility criteria to include 16-year-olds, we really quickly moved to secure the slots on the weekends so that we could invite high schools in our communities to come and get vaccinated. And just in time for all of those senior activities. So the first dose will be this Saturday. If you're signed up for Saturday, it's the 17th. And then 3 weeks after that is May 8th. And if you're signed up on Sunday the 18th. 3 weeks after that is May 9th. And then we all know you need to wait 2 weeks after your second dose to be considered fully vaccinated. And at that point, that's when all the fun starts for seniors, right? That's when your proms, your end of year celebrations. So the timing couldn't be any better. So we're here, and Dr. Walensky is here with me to not only talk about the logistics behind the day, but also shed some light, answer questions if there is any hesitancy or just general curiosity or questions about the vaccine or the process. We're here to answer them. So, Dr. Walensky, is there anything you'd like to share?
Well, you laid that out so well, Amy. So thank you to the Stamford school system for inviting me. I'm really happy to answer any questions. I'm a huge proponent of the vaccine. I got mine at the very first weeks. My wife's been vaccinated. My son is a high school senior as well, and he's scheduled to be vaccinated. I hope you all make the decision to get vaccinated. There are really an extraordinarily few reasons why anyone would not want to be vaccinated, or why a person could not or should not be vaccinated. Hopefully all of you come away from tonight really ready to join in. This is pretty much a worldwide effort to end this pandemic. So you want to do this for your families, you want to do it for your friends and loved ones, but really we are all in this together, and we're not getting out of it unless enough of us get vaccinated. So I'm ready for whatever questions.
Thank you, Amy, and thank you, Dr. Walensky. We really appreciate this. So let's go ahead and start with the first question. So there have been a lot of questions that we've been getting from parents to say, can children receive the vaccine, and what vaccine are children able to receive at this time? So maybe we could just start there to give a little bit of background of the 16 plus and the Pfizer vaccine.
Sure. And when you say children, of course, we do hope eventually to be vaccinating all children, but that's not really what we're talking about tonight. The emergency use authorizations from the FDA are for 16 and over for the Pfizer vaccine. At this point, the other vaccines that are approved under emergency use are for older people, I believe 18 and above. So we're doing the Pfizer. That's the one that is given now and then in 3 weeks, and it has been tested down to 16 years old, and with excellent results. Everybody's doing research now to prove that it's effective for younger children and even down to 6 months of age. So we hope to eventually get that information, but for right now, really all we can talk to is 16 and above. But keep your ears open for your younger kids.
Yeah, thank you. I think another question that students might want to better understand, and even for some of the parents and the adults, is just how does the COVID-19 vaccine work?
Yeah, this is, some people call it a new technology, but it's actually not new. There have been effective vaccines using this technology, and I'll describe that as best as I can in a moment. But this technology was created about 10 to 12 years ago, and they've created successful vaccines for SARS and MERS, the other coronaviruses that have come before, and thankfully did not spread to our shores in any way that required us to get vaccinated. This virus is similar but different to those, so obviously the vaccine needed to be different. This is a very interesting technology. They call it mRNA technology. There is essentially a piece of RNA, which is different than DNA, similar to DNA, but related to DNA, but not DNA, that is packaged in such a way that it doesn't get destroyed in the vial, in the needle, and in the arm. So that essentially protein is put into the muscle, and then the immune system takes it in, and when it sort of unwraps it, it is shown this protein, which then the immune system, the white blood cells, are able to create this very same protein, which is part of the spike of coronavirus that is what hits our cells and binds to our cells and allows the virus to be injected into our cells. So essentially, it is showing our cells this protein, then our cells take that protein, make that protein, and hold it out to the rest of our immune system, which sees the protein and creates an antibody completely specifically to that one protein. And then the immune system knows that protein. Essentially, when an infection comes to attack us, our immune system can recognize something as a foreign invader. But when we have the best immunity is when our immune system already knows what this is, and it already has the ability to churn out trillions of antibodies toward it. So essentially, it is teaching the immune system to make antibodies to this one protein. And then when you give the second dose, the second dose, by the way, there's some confusion there. It is exactly the same. From our point of view, there's no difference between the first and second. It's the same volume, it's the same vial, it's the same everything. But the second time, your immune system already recognizes it, so it's able to more quickly make antibodies. And with the combination of the first and the second, we are getting phenomenal results in terms of ability to prevent infection and even transmission.
Thank you so much. And also, I just want to mention that the city of Stamford has also set up on their website just vaccine information. So if you wanted to get further information in multiple languages too, you can also check that out. So
Right.
another comment.
Yeah, what I would say though is, having me describe it, not that great. There are great little videos out there that show you what's happening when I'm waving my hands, and it'll help you understand better exactly what's going on. And honestly, this is how our immune systems work. The reason you fight off infections that you've experienced before is exactly because those proteins have gotten into your system. Your immune system has learned them, and the next time your child coughs on you, even though they give you a whole wallop of whatever rhinovirus or corona, whatever cold virus they've just coughed on you, a lot of times you don't get sick because your body already knows that. I'm sorry, go ahead with the next one, Olympia.
No, that's fine. So another common question I think that we're getting is, if I had COVID before, do I need the vaccine?
That is a great question. And in a lot of ways, we don't know all of the answers. I can tell you first, let me start with the recommendation from the community, from the CDC, the Center for Disease Control. They recommend that a person be vaccinated if they've had COVID before, and they can be vaccinated as soon as they're out of self-isolation, meaning as long as they're allowed to be next to a vaccinator, they can get a vaccine. However, they say, because it is nearly unheard of for someone to get COVID a second time within 3 months, to wait 3 months for most people, and I suggest that right now, because we're still at a point where we don't quite have as many vaccines as we have people who want them. So if you really don't need one now, why not wait the full 3 months? And to my patients, when I'm talking to my patients, unless they are incredibly vulnerable or they had a terrible time with their first COVID, I usually suggest waiting 6 months, because we really don't see much second infections in the next 6 months. We are hoping that the vast majority of people who've had COVID will be protected for a year, maybe even 2 years, but we just do not know that. Really, the places that were overwhelmed with disease, a year ago, are now mostly doing pretty well. And so we're not, even if people could get infected, there's not enough COVID there to worry about. But in the United States, we were doing pretty badly last April, and we're not seeing a ton of a ton of recurrent infections. So mostly the answer is, yeah, we want people to get vaccinated. I don't think there's a big rush to it, but if it's been more than 6 months, I would encourage you to do so. The other question is, do you need 2 vaccines? And of course, we don't know the answer to that. There's some suggestion that for someone who's had COVID before, getting a single vaccine of the Pfizer or the Moderna will lead to so much immune response that it's just as strong, possibly even stronger than 2 vaccines for someone who's never had COVID before. And we have seen people who've had COVID before get the vaccine who get a more serious, tiredness and achiness and arm soreness and headaches and even fevers. So what I tell my patients is, if you get go ahead, get your first vaccine, and if you get such a crazy response to the first vaccine, you might just talk to me and we might wait for your second vaccine. But all of this is what I'm telling my patients. What the Center for Disease Control is saying is, we don't have enough information to make any recommendations beyond we want everybody to be vaccinated. So generally, there's not much reason not to get vaccinated if you've had COVID before. And if anything, it would extend your immunity from the disease itself. We know that would happen.
Thank you. And you kind of led into my next question, which is about side effects. And if you could maybe just mention some of the common side effects from the vaccine, maybe how long they last. And I know that one of the fears or questions that comes up around vaccine hesitancy is, if I get the vaccine, how do I know if it's side effects from the vaccine or if I've actually contracted COVID? Because I think some of them are similar. So it's kind of like 3 parts. What are some of the general side effects and how long? And then how do you know if it's a side effect or if you're actually, maybe have contracted COVID?
Sure. Well, first let me break it down into what happens immediately, because so many people are so worried about the anaphylaxis, like the life-threatening allergic reaction. So I thought I'd talk about that first. We know that it can happen, but the numbers are clear. This vaccine has been given to hundreds of millions of people now. 6 cases per million require an EpiPen and a transfer to the emergency department. So that's what is that? That's less than 1 in 100,000. So even if you're somebody who's had terrible allergies to a variety of things, certainly we'll watch you a little bit longer, but it's just not going to happen to you. All right. So anaphylaxis can happen, but it's much, you're much more likely to get, like run over by a car on your way over to the vaccine center than you are to, in the short term. Some people get a little bit lightheaded or their arm can get sore. Oh, I hope it just says my internet is unstable. Give me 1 moment while I get off of my VPN. That can help sometimes. And I can try to talk, and I can try to talk while I do this. So then what do we expect down the road? Usually people don't have several hours afterwards, although they can. The most common side effect, which usually happens 6 to 12 hours later, is arm soreness, and that can get pretty darn sore. That was the main symptom that I had when I was vaccinated, was arm soreness. It came at about 12 hours and was gone at about 24 hours. A lot of people do get headaches. Not that many people get fevers, but a lot of people will get uncomfortable in terms of chills, like, sort of like the I'm coming down with something feeling, which of course the I'm coming down with something feeling is usually your response to your immune system, increasing its activity. Some people will, some people will get some intestinal discomfort, like nausea, which is not something I would have expected, but it is something that people experience. Some people feel a lot of fatigue, and it's a mixed bag who can who can work and go to school the next day. You probably all heard the story of a lot of teachers. I can't remember where it was, getting vaccinated recently on over the weekend, and then on Monday they had to cancel school because so many teachers needed the day off. It is a very gentle vaccine going in. That's what I tell people when the first thing that most of them say to me is like, "Did you do it? Was that it?" Because the Pfizer vaccine is so gentle, and people often don't feel you injecting it at all. And I usually say it's that yeah, that's it. That in a year of intense science, but it's very gentle going in, but it does tend to have more side effects than what we're used to with most of the vaccines we give. But the great news is that they almost never last more than a couple of days, and then you're immune to you're immune to the virus, as immune as you're going to get, as I say. Usually people will say that when their side effects went away, they went away fairly quickly. So even people who are bothered substantially, we usually don't recommend taking Tylenol preventively, acetaminophen, I should say. But absolutely, if a person is feeling uncomfortable, that means that your immune system is fully charged up. And so if you use some Tylenol, you're not going to substantially blunt your immune system that's already in hyperdrive. Now, what we do see is, on average, it's the second vaccine that gives you more side effects than the first, but not necessarily. Everybody's a little different. Unfortunately for the people I'm talking to right now, it seems to be the younger, healthier people who get the more vigorous response. As people get older, for whatever reason, their immune system does not get quite as active. And so they often just get a little sore arm and not very tired, while the younger folk are more likely to be bothered by it. But as I always say, whatever you get, it's worth it, because now you don't have to worry in the same extent to the pandemic. And we're going to talk about just how you should behave in subsequent questions, and how invulnerable you are, really.
Yes, let's move into that, because I can relate to say that, I felt a sense of relief after getting the vaccine. However, one of the questions is, and I think a lot of especially high school kids are going to say, if I got the vaccine, why do I still need to wear a mask? Do I still need to socially distance when possible? And do I still need to wash my hands often? So can you maybe talk about life after the vaccine and the reasons why we still continue some of our behaviors?
Right, and of course, when we say fully vaccinated, remember, as Amy said, we say it's 2 weeks after your second vaccine. You really want the full effect before you adjust your behavior, so to say. So before we got the result of Pfizer, we were willing to accept anything that was better than 50% effective, and we would have been thrilled with it. Okay, when they came out and said that they were greater than 95% effective, it was staggering, and we suddenly realized we can really vaccinate our way out of this. And then Moderna came out, and their results are just about the same. So we're talking about 95% protection against any COVID illness at all, like mild disease. Okay, we have recently found out that it also prevents transmission of, you all know that COVID can be transmitted by people who are asymptomatic. We call it asymptomatic transmission. So it really does substantially drop asymptomatic transmission, not quite as much as it prevents mild cases. So I think the numbers are between 80 to 85, maybe as high as 90% prevention of asymptomatic transmission, while we're talking about 95% protection against mild to moderate disease. But even better than that, we are realizing that these vaccines give us nearly 100% protection against really severe disease, hospitalizations, intubations and deaths, which of course is what we are most worried about. So even though we seem to be trying to get into a fourth wave right now, the deaths have been declining steadily by about 30% every 2 weeks, even while the cases are creeping up. And I think that's what we're seeing is vaccinated people are not getting hospitalized. And of course, early on, we tried to vaccinate the most vulnerable medically and the most vulnerable socially, and that's making a difference. Unfortunately, we are seeing a rise in, 35-year-olds, 45-year-olds getting admitted as because they weren't able to get vaccinated, and because we're dealing with potentially a more virulent COVID-19 right now because of the variants. So what were you want to reroute me and remind me of what question I was answering?
Well, we're just talking about life after vaccination.
Oh, life,
If
yes,
you have
life
to,
after, yes.
Yeah, continue to wear masks.
Yes,
Why do we have to
yes.
do that if we're vaccinated?
So first, let me say what the Center for Disease Control is telling us we can do. And my guess is that with the coming weeks to months, they are going to give us more liberty. And of course, they're not taking away any liberty. I mean, this is all voluntary. Everybody can go cough on each other all over the place, but you shouldn't. They're telling us what we should do and what we shouldn't do. And we should really pay attention to them because they are following the science. And they have told us that once everybody around you is vaccinated, and we're not talking about out in public right now, right? We're talking about family, friends, gatherings. If you are gathering with a group of everybody that's fully vaccinated, if you feel safe enough, you can take off your masks. We had our grandparents come, and of course my kids are not vaccinated, but we went unmasked. We did masks for the hugging, and then they were with us overnight and the next day, and we did not wear masks. And that was our decision. We talked about it and we decided that's how we're going to do it. You make your own decisions, but when you're in a group that is all fully vaccinated, then you should feel reasonably safe keeping your masks off. Of course, if anybody is feeling sick, they should get tested and self-isolate. Don't mess around in a pandemic. If you're sick, you stay home and get tested, because we absolutely know that if you're vaccinated, you can get infected. We absolutely know for sure that if you're vaccinated, you can get the infection and asymptomatically transmit it. We just know that that is all markedly decreased. Okay. And so all of these things I was just saying you can do when you're in a modest group in your home or wherever. When you're out in public, that's different. Okay. Not only that, but you don't know who's vaccinated, who's not. So now what I can tell you is I was very, very careful throughout the pandemic when I was going into a store. And first of all, I didn't go into stores for months, but when I started going into stores, I would put on a high quality mask like KN95, something that would filter out 95% of anything. And I would keep my distance. Now, when I go into a store, I still wear a mask, but I don't wear one of those highfalutin ones. I wear a regular disposable surgical mask, or even a cloth mask with a little filter in it. And if somebody walks by me or even stands by me for a little while, I don't worry about it that much. And I don't really worry about anything outdoors. I mean, I wouldn't want to be in an enormous stadium with every seat filled with my mask off. But the outdoors protects you about 20-fold. I don't have statistics to back that up. I heard a scientist say that many months ago, and I hope it's true. But we certainly know that outdoors is way safer than indoors. So I don't feel, I feel that, just about anything you do as a vaccinated person outdoors is just fine. You got to remember though that you're around other people and those people are worried, and I think that just right now, politeness in society is to wear a mask whenever you're around somebody. And you don't know, there might be somebody who is very vulnerable to it and it feels unsafe with the vaccine, or for whatever reason cannot get the vaccine. Or the person next to you might have been vaccinated and then gotten a bone marrow transplant. You don't know. So really right now, when you're in public, inside, you're going to want to wear a mask. But it's for most of us, it is a calming down of the worry about who's going to infect you, because you're really quite protected. But remember that you can catch it, you can transmit it. So if you're hanging out with great grandparents and they've not been vaccinated, you probably shouldn't be doing that, unless you have been, reasonably quarantined and extra safe before that. But of course, try to convince those people in your lives who are vulnerable and believe this is all a hoax, or for whatever reason think that the vaccine shouldn't be given, whether it's all of the misinformation out there, whether they think that Bill Gates is putting a 5G chip in them, or that the vaccine is killing people all over the place. There are people, if it will take you 5 minutes on the internet to find out absolutely horrifying things about this vaccine. And they're lies. But what was it, Mark Twain, who said that that a lie can make it around, a lie can run on the earth while the truth is still putting on its sneakers. These lies are just, people read it, they believe it, and people will say, I just want to do some research. And that means they're going to get on the internet and find all these people who are telling them just how bad this is. But I myself have given, probably nearly 1,000 vaccines, certainly more than 500 vaccines myself. And I've talked with, so many of my patients who've been vaccinated, and everybody says the same thing. They're so happy they did it. They're just so much less worried. And, and I've talked plenty of people into it. It's getting harder because the people who are the most resistant are now the ones that are on my list of trying to convince.
Thank you. And I
Sure.
think we're getting close to time because we are going to switch over for Spanish here.
Oh, yeah.
But I think just to bring out some of the key things that you said, going back to making sure that you're getting information and seeing who you're getting information from. Really, it's important to get the information from the people in the medical field who are working closely with this and really understand it. I think you gave us really good information about, our practices, and we know the coronavirus has really flipped our world upside down since it became known to us. And I think everyone has been resilient over the things that it has brought, and just really, reiterating that it is a personal decision, but the level of calmness that it can provide, or comfortability that it can just give you as an additional layer, an additional mitigating strategy against contracting COVID-19. So with that being said, are there any closing remarks that you want to do or say?
I would say that the same people who are not going to get vaccinated are also the people who are against masks. So this virus is going to be spreading for quite a while. And if you don't get vaccinated, the likelihood of you getting it as restrictions are lightened and people aren't wearing as many masks, the likelihood of you getting it is substantial. And even for the people who don't wind up hospitalized and don't wind up dying, there are a lot of, serious complications. And I have a number of patients who got it more than 6 months ago and are still absolutely miserable. And some have not returned to work. Some have not returned to, being able to bathe themselves. So, if you just look at the deaths and the hospitalizations, you're just seeing the tip of the iceberg. This is a tragic infection for a lot of people. And we're waiting to find out how all of these people who had mild disease, whether there's anything that they're going to be at risk for down the line. So any concerns you have about the vaccine, think, how does that compare with my concerns about the virus? And it should be at least 1,000th of it.
Very excellent point. That was the deciding factor for me as well. So just want to say thank you to Amy Taylor. Thank you to Dr. Linsky. Thank you, Laura, for joining us for this session. And Mike, thanks for always being here. So I'm going to stop, and we'll probably take a 5-minute break, and then we'll come back on.